the direction of Spanish Rashid towards the smart government. And we found that the best application of smart government is to be very flexible, very dynamic, and I think this is, for the time being, the latest what has been achieved by mankind. The application of laptops and the iPads, and through this, actually, we will provide all our services through them. But actually, the basic idea was how to give the best service to the patient inside the hospital, on beds or visitors for any reason. So through this, they can have some sort of, it's like everyone has his own individual personal TV station. He can watch movies, he can watch cartoons for kids, for any other these sort of usage. In the meantime, he can have access to all the Dubai government services, so he can do his normal routine work as even if he's in the hospital. Also, we can carry a lot of surveys through these devices. We can do a lot of health promotion through these devices, and it will enhance our relation with our customers who's coming to DHA hospital. And it is two-direction communication with us.
And when you give the opportunity for patients to actually comment about the services that you provide, do you have like a certain expectation in terms of feedback? Are there services that you would like to actually highlight during the first phase when you?
Actually, this will give us a very powerful view that we can tell the people immediately any development, any new things happening. Health in general or the DHA and the service that can provide to them immediately, and it's very powerful. Whenever he opens the device, about cannot and tells him about the latest. But in the meantime, the surveys and any feedback coming from our customers is the main essential and very powerful means to improve ourselves. So it is not a criticism, it is just a way of highlighting the problem. They all together work together to improve these problems.
Obviously, it will help the customers, but how important is this, or how significant is the impact to the healthcare providers?
It's for sure very important, because when I get the feedback from the customer, through that I can develop and improve. If I give my services to the customer online, he can have access to a lot of the services without being without requirement to come into the DHA places or premises. So it's very, very important means of communication, where you can get the service, or you can give the comment, you can reserve the appointment, access the test result. All these are very important to the people.
And how immediately will this be available in Ultra?
We are starting today actually here in Nad Al Khamar, where 30 devices will be installed, and we will work gradually to cover all of the primary health care and the hospitals.
So is your goal is that by what certain period will every patient in every hospital will get?
Within 2-3 months, we will cover all the DHA.
Okay, so thank you very much.
Do you think this could affect the relationship between patient and doctor? Maybe it will become less personal?
Yeah, for sure it will enhance, as the patient is more comfortable. Even when you treat somebody, the medical treatment is not alone enough. Also the psychological situation of the person is important as well. So this improves, it enhances the health condition, and the chance to cure quickly, because he is more comfortable and he has a full picture of his test result and all of these things. So that's for sure, it will make the relation much better, I think.
Okay.
The information that's with the doctors as well as with the patient, is it the same?
Actually, this is not EMR, not the medical record. No, this is not the medical record. But eventually, this will be connected to it when we finish. But for the time being, this is only just any normal laptop. You can use at home, you can use it. It's the same.
It's more for their entertainment
benefit, surveys, as I said, means of communication with the patients, and the health promotion programs which we launch from time to time.
Will it also be connected to the nurse's desk?
Nothing to do with that.
Thank you. Thank you, sir.
Your Excellency, I would just explain responsible. I think everyone is asking for this. So if
have an IT roadmap, and we're going to implement that later. So laptops for doctors will be given to them at a later stage for their own use. This is for patients' use. And we're looking at, we're looking at it in 2 to 3 years time span. Maximum.
Okay, and the reason I ask is if I'm a doctor and I come to see my patient, will his iPad have the details, or can I just take it and see his medical record, or do I have... Okay.
This is the eventual solution, just not 3 years.
Okay, so that's the long-term
solution, yes.
Thank you.
But will doctors and nurses visit the patient less on them?
No, for this, no.
They will be the same visits. Okay.
Yeah, but we shouldn't link, the electronic medical record
Yeah.
To the...
total solution with this. This is something different.
Okay.
Currently, patients will have no access to their medical records. DMR is in the pipeline.
And then as we finish that, then this all will be made available.
So sorry, so currently they can access DHA application, they can access government services, and for entertainment, whichever, social media and other things at the moment.
Yes, and the health program, which we will launch.
The health
sometime,
promotions.
yes.
Are any surveys planned
Surveys
this year,
also.
right now?
What kind of survey?
I need surveys. I mean, I give to my staff ability
To conduct them.
to conduct any surveys whenever they want. Through them, I mean,
So this, I mean, there is